Okay, another quick video, hopefully. A little background, I'm a 51-year-old new grad nurse. I've only been a nurse since COVID started, so basically, what, a year and a half now, right? God, you think it's crazy, right? I remember when they said might take 2 years. Now it might take 3, it might take more, whatever. But it's becoming endemic. I'm hopefully, you know. Sidetrack on that, whatever. But that's something, by the way, you will have to accept as part of your life now. It's like my professor said, we try to prepare you guys for everything. We weren't expecting the plague. Now we have to live with it. It's not the same as, because I grew up in the era of HIV came online, and I remember some of that, and I hear some of the older nurses saying, yeah, it was freaking them out. But it wasn't like it is now with masking every day. Everybody masks, It's a totally different animal in that sense, but it is somewhat similar in that regard. Don't want to sidetrack too much. Just a quick video about what is the most difficult part about becoming a nurse. Like that. So that's the transition. We're talking the transition from layman or whatever training you had before. It was nursing tech, EMT, whatever, to becoming an RN. Okay, and you might go beyond that. I'm just saying, for that transition to become an RN, what is the most difficult aspect? And I think this holds true for regardless of what you do as a nurse, because there are some RN positions that you don't interact with patients, actually. There are some, or you don't interact with them a lot. There are some positions where it's very minimal, very quick, or the population there's not a lot of feedback. I've said this about PACU or OR. You're not really getting that much back and forth with the patient, But by and large, most nurses, I think it's something like 60-70%, go into med surg, because that's where most of the nurses reside. That's where I am. That's where most nurses work. You will have a lot of patient interaction, but like I said, I caveat this video by saying this applies to, in my opinion, all nurses. The most important skill you must learn. You must learn. This is not an option. This is going to be, you're going to be gauged and graded and evaluated immediately by wherever you work. Okay? This will mean whether you keep that job or you lose that job or you get more training or what have you, whatever. I'm not joking around. This is exactly what you're gonna be gauged against. I guess that's still the best word, and that's time management. How well you manage your time. I kid you not. People are going to say, "Oh, it's procedures." I'm going to be the greatest nurse. I'm going to be the most caring nurse, and I'm considered a very, I don't want to say caring nurse, but the subjective part of my nursing game is considered by my peers, I think, to be top notch. I'm, that my technical skill set, the objective side still needs brushing up. I still need to brush up on that. I still need to train on that, and I always say that. But neither of those, let's say, leadership skills, all that stuff, no, push that all aside. It's going to be time management. Why? You're paid by that. You're gauged. Even if you have a set salary, you're gauged on how many patients you can go through, you can take care of, and if you can take care of them in an at least adequate level. To do that, you need to manage your time. That is more, I don't want to say more important, everything's important, safety, whatever, but that is definitely the skill The number one skill you're going to be gauged against. Spoken with, managers and see how they gauge. I've, kind of peeked and see how preceptors gauge it and what the questions are from the educators or the higher ups. How are they doing this? And it might be like, oh, how well are they doing MedPass? How well are they doing this skill? How well are they doing this? But always the underlying current to every one of those is time. And on top of that, you'll see as you're oriented in, you get one patient, you get two, you get three, you get four, you get five, you get six, you might get 7 or 8, depending on your unit. We kind of stop we actually stop at 6, but there are many times we get 7 or 8. Just the other day I had 7, and the other day I had 8. It is what it is. You handle the load that you handle. Anything above that becomes very questionable on patient safety. I'll say it out loud. You can't overwhelm us, and that's the issue with COVID and whatever. That's what I said in the beginning. That's an issue on itself. That's a societal issue, and that's a systemic issue. But time management will be the metric you're set against, and you have to deal with. How you handle that, that's really subjective. That's really individual. It's like saying, how best can I study for nursing, Ray? Well, depends. Are you a visual learner? Are you audio learner? Are you tactile? Maybe a combination of that. I believe most people are a combination of that. I like audio and I like tactile. I like writing out my notes. I do that now for nursing my work. People say, why do you write out your meds 3 times? I do it for safety. I do it so I know inherently what meds I'm supposed to get, just by memory, and I need that because I'm old. And it shows that I really know the patients too. It's like, okay, no, they're supposed to be getting, 20 milligrams of Lipitor. No. You gotta have a full glass of water with that. You gotta be upright for that. Blah 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 blah. Whatever. You get the knowledge there. But I come in extra early each shift, an hour at least, before every shift to do that. You don't have to. I mean, if you can prepare in 5 minutes, fine. You can prepare in 5 seconds, that's fine, as long as you can do the job. If you arrive 5 minutes and it takes you 30, you're, an expletive, because you made the next nurse wait 25 minutes after shift to leave or start giving a report, and you're 25 minutes late, and you will get written up, and it will gauge against you, and whether or not you continued employment will be, whatever. Yes, there's a high demand for nurses, but the demand is for competent, able nurses. We do not need any incompetent nurses, okay? 0. We don't need any of those. So we only need competent nurses. We only need able nurses. That's what it is. And time management will be your number one gauge, So it's one, and I it's like, oh, right, it's enough to, I learned how to insert a goddamn Foley, and you want me to freaking think about how quickly to do it? Yeah. Actually, yeah, you do. Because you have to be very, in my facility, you have to be very time sensitive about that. You have to do it right. You have to do it completely sterile. I have to have another RN witness. So I'm taking their time from their patients. And I have my other patients to deal with. Then forget about charting. No, you can't forget about charting. You got to chart all that stuff. So think about all that. Now, in my instance, for my facility, I'm sure not every facility requires a dual RN sign-off for that. But I'm taking somebody else's time too, on top of my time, on top of my other patients. You have to chop it up. That's the hardest part of med-surg. ICU is difficult, don't get me wrong, but you get 1 or 2 patients. I could stare at them all day long, okay? And I got the resident right next to me to sign orders. It's hard. It's very nerve-wracking. I wouldn't want that job. It's beyond me technically. But then you tell that same, I've seen a lot of ICU nurses go back to med-surg or go to med-surg and you're like, you want me to handle 6 patients and deal with their BS? That's the thing. They don't mind the technical aspect. They could do that standing on their heads. The BS aspect, they're like, forget it. I'd rather call up 4 code blues, right, in a row. They like, I don't care. I'm not dealing with the BS of family and all that stuff and transfers and the patients themselves. They're awake. Put them to sleep. And I'm like, you can't just do that. You can't just sedate them. And they're like, yeah, I can. Let's intubate them. Take care of it. No. They're talking, yeah, that's what patients do most of the time. Yeah. So, you have to balance that and you have to be caring. You see, remember what I said about that subjective aspect? And I'm sorry this video is dragging on, but that caring side, try to cut somebody off in discussion and still be polite about it and rush to the next one who might want to have a good discussion with you. And you have to do this all within a set time limit, hour, 2 hours tops. That's your med pass right there. You start early, you start an hour before, you get an hour after. I think that's pretty universal. And most people say, hey, you could do that. You got 6 patients, 15 minutes each. Let's say if they're doing it, whatever. No, it doesn't take me that long. You're gonna get better at it, and you'll get through it. And you have to prioritize your patients. People say, well, I'll just put all the difficult, long, lengthy med passes at the end, and that's initially what you would think to do. But what if those are the seizure patients, and they need their Keppra, they need their Vimpat? You ain't doing that. The Dilantin has to go in at this time. You can't screw around with that timing on that. They can seize. So what are you going to do? And they're all peg tube, and what have you. And they got to be one after the other. So you have to gauge your time. You really have to manage your time well. And sometimes you're gonna be right on the razor's edge, and you have to get that done in time for their safety. Okay. So good luck. Any questions, I will definitely field and try to answer them to the best of my ability. But yeah, when people say, hey, you got to know this skill, you got to know that skill, no. Time management, done. That's the first and foremost, most important one. You got to know the rest, but the most important one, and it gauges you on quickness through orientation and how quickly you're starting to be on your own as a real RN will be your time management, because that's what the manager's going to say. Hey, can they handle a full load? They can't handle a full load. They're not yet a full RN to the manager's eyes, because they have to babysit you still. Okay? The quicker you can be on your own, the quicker you are a contributing member to the staff. Okay? Good luck.